Thank you and welcome everybody. Thanks for joining us for a few minutes, and I literally mean a few minutes here today. We're doing a quick hit 30-minute session on No Surprises Act. So hopefully the topic is not a surprise to you. So since we sent out quite a bit of enrollment material. So I'm David Gregory. I'm a partner and principal with Baker Tilly and one of the healthcare consulting leads, and I'm joined today by Michelle Ray. Michelle's a senior manager in our healthcare consulting practice, and Michelle is also recently a chief operating officer of a health plan. She's also got provider experience in her background. I too am a former hospital administrator and have also have some experience as a health plan administrator. So Michelle and I are both bringing experience on both the provider and the payer side of the No Surprises Act topic today. And very happy to have you jump along, and we're going to impart some wisdom on you today on this last day of spring. Actually, tomorrow will be officially summer, and we're gonna take you through some of the opportunities in the No Surprises Act. We know there's a lot of drudgery. We know there's a lot of requirements. We know there's a lot of things you might not love about the No Surprises Act. We get that, and we acknowledge that. But there's also some ways to get ahead and some ways to differentiate and some opportunities, right, that we wanted to make sure that you are aware of. This, of course, is part two. The first part was several weeks ago and was really more laying out the facts and requirements of the law and the guidance. And now we're here more to talk to you about perspective and operational implications, et cetera. So glad to jump right into this. If we could go to the first slide, I'm going to review the learning objectives, and then I'm going to ask Michelle to take us through several of the roughly dozen slides that we have here today. Certainly, as indicated before me, questions can be lodged with us, and we'll try to get to them either on the fly or at the end. We have one polling question at the very end of this that we'll get to, time permitting. Okay. So learning objectives. So we are, number one, going to explore the importance of evaluating the efficiencies that can be created beyond the pure kind of check the box, meet the requirements of the No Surprises Act. So we're just asking you guys to think about pushing yourselves a little bit beyond just the requirements and kind of the drudgery of making sure you meet those requirements, and then actually identify the actionable measures that can enhance the operational efficiencies of complying with the No Surprises Act. So I know this is not a dynamic requirement. I actually do think this rule is actually delivering the intended consequence, which is to reduce surprise bills showing up in your mailbox as a patient or a member. And we think there's been some progress on that front, but there's still a lot of opportunity for improvement for sure. But those are our two learning objectives today, Michelle, and I'm going to ask you to take it from here, and maybe we'll advance the slides, and Michelle can start with a bit of an overview before we get into the opportunities. Go ahead, Michelle.
Thanks, David. So No Surprises Act, just an overview of the Act. It was implemented January 1, 2022, applies to plan policy years starting from that date on. It establishes patient protection for surprise bills to unexpected costs. It is established a process to determine the out-of-network rate. It also talks about what the qualified items are. Specifically, it's emergency services, non-emergency items, and services furnished by out-of-network providers, and air ambulance services. It limits the cost sharing to in-network deductibles and out-of-pocket maximums. It applies to services payable by health plans in the group and individual markets. It does not apply to Medicare, Medicaid, CHIP, or TRICARE. And it also, more importantly, establishes a patient-provider dispute resolution process for uninsured self-pay patients. Next slide. So what services are included in the No Surprises Act? So it's primarily three related categories: emergency services provided at an out-of-network facility or from an out-of-network provider, including post-stabilization services. It applies to, which is very important, air ambulance emergency transport services, but not ground ambulances. Traditionally, this has never been covered, and air ambulance emergency services, as you can imagine, is a very expensive service. And thirdly, non-emergency services provided at an out-of-network provider at an in-network facility without the member knowingly electing that provider or giving consent to be billed. So for example, when you're getting services in a hospital, you don't typically select your anesthesiologist, you don't select your radiologist. And so this is that's an example of the type of services that's protected. Next slide. So what are the main provider operational compliance highlights in order for a provider to comply with the No Surprises Act? First of all, you need to inform your patients of the No Surprises Act rights, verbally, written, and digital format. You need to provide a good faith estimate and include co-providers in that good faith estimate. But that right now has not been implemented so far, the co-providers, but you must provide a good faith estimate. You have to adhere to balance billing regulations limited to in-network cost share. Again, members are only liable now at this point for their cost share and co-insurance. Implement an open negotiation process with the plan. So when a health plan reimburses you, you have the opportunity to then go back to the health plan within a 30-day period and do an open negotiation process prior to implementing the IDR. Develop and implement claims and service management process to assess reimbursement adequacy. Participate in the open negotiation process and the IDR process. The IDR process, you have, after 30 days of the open negotiation period, you have the ability to implement the IDR process, which goes through the federal dispute resolution process. Develop and implement operational processes to comply with requirements and provide patients with access to costs for healthcare services. Next slide. David, did you want to comment on this?
Oh yeah. I thought you were going to kind of hit it first, but So this is really, this is really, as I said at the outset, these are the opportunities that we see, or the silver lining, if you will, in this requirement. We tend to look as the glass half full and not half empty when it comes to, the requirements, et cetera. And certainly decreasing or lessening your administrative burden. Remaining out of network does create some burdens that can be eliminated. But I think one of the biggest things on here is the increasing cash flow, right? Because to the extent that you can better define what a patient's responsibility is through the process that Michelle just described, you as the provider can, have a better idea of what that collection should be, and then put the right processes in place to actually collect those dollars, and then of course that enhances your cash flow for sure. So and also volume opportunities certainly come along with this as well. So we just wanted to point out again, this is a quick hit session, so we're already almost to the halfway point of this presentation, believe it or not. But we wanted to make sure that we just pointed out that there are some opportunities to help your own revenue cycle, in the process through some of the things that are mentioned here on this slide. So I don't know if you had anything else to add there, Michelle.
No.
Okay.
Next slide. So the beneficial impact of being an in-network provider. So with the No Surprises Act, I think one of the opportunities is to actually encourage providers to become in-network and no longer remain out of network. And so what does that mean? What is being in-network mean to a provider? So first of all, it expands the number of payers for which you're participating. It increases your referral base because now you're part of an in-network, a network, and you're expanding your relationships. It's an opportunity to increase revenue. It also gives you the opportunity to improve your rate negotiation leverage. Partner with the health plan and align with their strategy, develop operational processes with other providers to comply with the NSA. There's a lot of intertwining when it comes to negotiating with other providers, and so this is an opportunity. And then it establishes relationships with providers. Next slide. Improving operational efficiency. It's also an opportunity for that. So out of network is costly from both a time and staffing perspective, and being in network at this point would just improve your operational efficiency. Out of network, once advantageous prior to No Surprise Act, is no longer cost effective. So it really encourages you to become in network. It reduces your appeals and claims reconsiderations, because being out of network, oftentimes you're disputing your payments and you're going through a whole claims reconsideration process, which is timely and cost. Improve operational efficiency by reducing administrative work. Eliminate the need to initiate the IDR process, and improve patient satisfaction. Next slide. Improving forecasting revenue. So being in network, you know your fee schedule, you know what your reimbursement is going to be. And so by having that, you reconcile your revenue and expenses, develop a budget based on your expected reimbursement, eliminate the unknown. You do know what you are going to get paid. Implement a financial reconciliation process, and improve fiscal forecasting based on multi-year payer contracts. Next slide. Increase cash flow through point of service collections and bad debt reduction. As David pointed out in his overview, you gain a thorough understanding of your cost and the patient's financial responsibility. Collect patient responsibility up front at the point of service delivery. No longer wait to collect patient responsibility post-delivery, which oftentimes it ends up going to collections, and so that process is eliminated. Improve patient satisfaction by eliminating the collection process. Patients, nobody enjoys going through a collection process. And implement revenue collection process and set realistic expectations. Next slide. So what are some strategies that providers can implement? Well, first of all, revenue reconciliation process. Payer inventory, taking an inventory of your payers and deciding which payers are you want to continue to participate with or add. Operational revenue. Your referral network, very important. Your referral network will increase when you become in network. Provider updates, which is also really important from a provider standpoint and your operational processes. It's really important that you're notifying the health plans timely of any updates to your practice. And then your payer relationships. You establish relationships with key payers and network management staff. It's very important to have a health plan contact and really develop those relationships.
Yeah. Yeah. So I would add one or two other things, Michelle, to those opportunities as we wind up here. So suggestion that the other big requirement of providers over the last couple of years is the price transparency requirements. And Michelle, I know you more than I have worked with some of those files, and we've also had that data be incorporated into negotiations. And I just bring to the audience's attention that when Michelle talks about being in network and using the No Surprises Act as a positive way to build new network relationships. Don't forget about those price transparency files that can be leveraged in a very positive way, right? We at Baker Tilly we help our provider clients negotiate with the health plans, and we are routinely now using the price transparency files. Either for the hospital itself or for the competition, to really get a nice, clear understanding of what the market looks like from an in-network rate standpoint, right? And with that new kind of transparency that's out there on the in-network side, you can definitely use it to your advantage and leverage the best possible in-network rates. Because some of you might be saying, well, being out of network is not such a bad thing if we get paid some high percentage of charges, right? And that actually provides us with some leverage if we're in network, to be able to have the ability to say that we want a high percentage of charge on out of network, which this requirement effectively eliminates, right? So I guess I'm just a long way of saying that. Be mindful of the transparency that's out there, not just within the No Surprises Act, but also within the Price Transparency Act, and use that to your advantage as you increase these in-network relationships. Now, some of you might be saying that's really not for physicians. The price transparency, we get that. It's mostly about the hospital, and some of these requirements relate to the physician side of things, but certainly it's something to keep in mind for sure. But I think that overall patient satisfaction, as Michelle said, it can be really significant and can be a differentiator in the marketplace. For you, you can have a reputation as the place that doesn't have all these extraneous bills that frustrate patients. And that can be a real differentiator in the local marketplace for sure. So, great job, Michelle. And we actually we're landing this plane, on the early side, which we tried to keep this content as streamlined as possible. And certainly as we indicated at the beginning of this, there's a lot of materials out there on the facts and the requirements that are in the law that are on our website, on the links that were referred to previously. And if there are any questions that folks have, we'd be more than happy to entertain them. We do have a polling question here that we'd love to get a response on, if we could. So how many times have you participated in or initiated the IDR process? So we'd love to hear from all of you. I think the polling is probably open now. You probably see on your screen the ability to respond. And it'll take, a little bit of, maybe 60 seconds or so for the responses to come through if you're interested to see what your peers have been doing. But, it's basically 1 through 5, 6 through 10, 11 through 20, or have you actually experienced this thing more than 20 times, which I don't envy you if that's been the case, but certainly interested in what the response is. So, And it looks like we do have a question here, Michelle. And we can take this offline as well and give you more robust responses. But it looks like it says, do you have any recommendations to improve the GFE requirements and/or workflows? Any thoughts there, Michelle?
With the good faith estimate. So I think what's really important is to, first of all, educate the staff and make sure that your staff understand the requirements and what's involved, and then to really implement upfront a process to to administer the good faith estimate. I mean, that would be my recommendation. I think it's really just knowing the requirements and then having that process in place. And also, too, I think just to make sure that it's clearly articulated to the patients. I think that's really important. And make sure all parties involved have a clear understanding of what it is.
Right. I really think it comes down to nice, clear, crisp, communication mechanisms, right?
Yeah, absolutely.
To the patient, and to the participating providers in your network. I mean, this requirement is all about communication, transparency, and disclosure. Yeah. Right. And it's in the spirit of what's been happening in healthcare over the last decade or so, is that healthcare has always been criticized for having a bunch of black boxes, right? A bunch of processes and negotiations and things of that nature that happen in the middle of the night. And the patient's not sure what's going on. Sometimes the providers aren't sure what's going on, right? And everybody's confused, right? And that's been the frustration in the healthcare system. And this is another step. We're not saying that it's perfect. Don't get us wrong. We're not saying that this NSA process or the price transparency process that I also referenced are perfect. But their ultimate objectives are to shine a light on these processes and to be able to enable the patient to understand their liability for what they're about to do from a healthcare standpoint as crisply and as accurately as possible, right? And so I do agree. It's all about the communications and having those operational workflows make sure that communications are effective. But it is, as Michelle said, it's educational for sure, and it's not just the front end people. There also needs to be education of the contract management folks and other things. So just think of it a little bit more broadly than just the people that are collecting the money up front. Michelle, I'm sure you'd agree, right? But it's also about educating other parts of the revenue cycle that are going to, be involved there for sure. So
yeah, and I think what the No Surprises Act does, it introduces the patient-provider dispute resolution process, which is something new, right? So when you give a good faith estimate, and, if the charges are greater than $400 difference in what you've provided to the patient, they are entitled to initiate the patient-provider dispute resolution process, which obviously, as a provider, that's time-consuming for you. That's a whole other process that needs to be implemented. So I think it's really important to understand that process too.
Yeah, absolutely. We've got a couple more questions, Michelle, and we've got 4 minutes. And I just wanted to share the response on the polling question. Over 80%, 83% of you have only experienced it one through 5 times, and I imagine some of you haven't even experienced it yet, right? So, and we only had a couple of folks, go into that 21 plus category. So we do have a couple of warriors out there that have been kind of experiencing this in at some sort of volume level or scale level, but many of you are still kind of new to the process, and it's going to evolve over time. So just wanted wanted to let you know just so you understood kind of where your peers were for sure there. The other questions, Michelle, from your experience, are most health systems providing estimates automatically in Epic or manually? We've seen it both ways. I don't know if you have an opinion there, Michelle, but certainly it's a consultant speak to say it depends. But do you have a perspective on that, Michelle?
No, I mean, that's a very interesting question. I think something definitely worth thinking about and doing some research on. But yeah.
Yeah, we'll circle back because thank you very much. Each of these questions is coming through with an identity, which means that we're able to follow up, right? And so we'll poll our staff in terms of whether it's more manual or kind of Epic or system driven. I think that my experience, personal experiences, it's been more manual than it has been automated to date. I think the goal is obviously to have it be automated, but we are seeing more manual at this stage of the game. And then we also have a question about, clinicians generally do not discuss payments with patients. This is coming from a hospice provider, which is a unique service in terms of the communication and the level of communication and the content of communication, right? In that kind of end of life situation. How are other providers getting this information, to patients? So we also have a name associated with that one as well. So we will, in the interest of time, since we're coming down to the bottom of the hour, we will get back to the person that asked that question about how providers are getting the payment information, to patients. And then we've also got a question around the 90-day cooling off requirement for any dispute resolution. The question being, and maybe Michelle, just a quick response, is the 90-day cooling off requirement for any dispute submission, or is it just for bundled submissions? I don't know if you have a perspective on that one, Michelle, or if we should just follow up with the person afterwards.
Yeah, no, we will definitely follow up. I think that's also a very good question. That's I don't believe has been asked before. So
right, yeah. So we will get responses again. Thank you for providing your identity. So we've got names attached to questions. We will follow up with you in the next couple of days with more specific answers than we've already provided. And Michelle, thank you very much for presenting today. And again, the overarching theme coming from Baker Tilly on this webinar is that look at it as an opportunity, not as a kind of another requirement to just check the box. There are ways to use this to your advantage, and also leveraging some of the price transparency information that we also reference as well. So we want food for thought, and we will get back with those that ask questions. Thank you very much for putting those questions out there. And if you have other questions, here's where you can reach both Michelle and I. After the first webinar, which we had over 400 attend, we had lots of questions coming from the group, and we welcome those questions. So if you didn't get an opportunity to get any feedback from us on the questions, you still have one. Either put it in the chat or send us an email. Here's our email information right here. And we are going to land this plane almost exactly on time here today. So Michelle, again, thank you very much. Thank you to the audience for sure. And have a great last day of spring and tomorrow's first day of summer. All right. Take care.